As a veterinarian, I have to prescribe medication to my patients every single day, of course. And just like you will, in all likelihood, have to take medicine at some point in your life, so will your cat. And I always like to ask my clients, how do you feel about giving a pill to your cat? Because for some people, that's a really daunting task, especially if you've never done it before. And there are different methods of giving your cat a pill. And I always like to start with a path of least resistance. So make it a pleasant experience for your cat if possible. So if it's a medication that can be crushed, always check with your veterinarian to ask if it can safely be crushed. Try it first, crushing the pill and mixing in a little bit of canned food, a little bit of yogurt, that's fine, as long as your cat eats the entire amount of food containing that medication. That, of course, is the easiest way to do it, but of course not all cats are willing to eat canned food or yogurt, especially if they can smell the medication in it. Another thing that's nice to try is using a treat that is intended for actually giving medication. These treats are nice because they're salmon flavored and they have a strong odor, so a cat is less likely to smell the medication inside of it. So what you do is you take your pill, and these treats actually have a hole already in it, so you can put medication directly inside of the hole, like so, and you just push it on down, close the treat around it. Again, they're nice and pliable, so you can do this, and you administer the treat as a whole. So Scout here loves treats, but sometimes she knows when there's medicine in it. So I'm just gonna offer it to Scout and let's just see. No, true to form, Scout does not want a treat with a pill in it. So we're gonna have to go to plan B and use a pill popper. This is a pill popper, and these are a great way to safely administer a pill to a cat without actually having to get your fingers inside a cat's mouth. Most pill poppers can be loaded fairly easily. They all have a plunger here at the bottom, and this plunger can be pulled back according to how large the pill is. What it does is it creates more space when you pull it back up here where the pill actually is set. So if I pull back, it creates more space. If I push forward, less space. This is a fairly small pill, so I'm just going to pull back slightly on the plunger and load the pill here at the very end. There's a soft rubber tip and it's got some slits in it that are designed to hold the pill snugly. And as I push this plunger, when I have this pill positioned all the way in the back of her mouth, I will push this plunger and it'll force this pill outward. Okay, now let's see how this works out for Scout. Now I've got my pill popper nice and loaded, and a lot of times people are doing this by themselves. They don't have two people to help hold a cat and administer a pill. So I'd like you to get comfortable with doing this by yourself. And the key is to have a nice place that is difficult for your cat to back up, because the first thing a cat is going to want to do when they're in a situation that they don't want to be in is they're going to want to back up. So it's best to have your cat on your lap. So if Scout backs up, she can't really go far because I'm right here, or be on a table where you're in an upright position. The point is don't provide an outlet for a cat to back up, because that's the first thing they're going to want to do. The second thing is I need to control Scout's head, and this is something also you really need to get comfortable with, and how to control a cat's head. Don't be shy about grabbing the scruff of a cat's neck, and the scruff is this loose skin in between their ears and the top of their neck. Don't make the mistake of trying to grab a scruff way down low in between their shoulder blades. A lot of people make that mistake, and it gives you no control over the animal's head. Try to get up as far as you can up between the ears and the very top of the neck, and this gives me great control over her head. Don't worry, this is not a painful thing for cats. They're very used to being held like this. In fact, it's a comfort when you are in control. So I'm going to grab the scruff here and I'm going to pull Scout's head upward. I don't want her head hanging down. I want it upward, even to the point it's not wrong to actually lift them up to where their feet are off the table or off your lap a little bit. Now here's the key with using this pill popper, is you don't want to shove it in the back of their throat. You can actually harm the back of their throat. You only want to put it in far enough to place it in the very back of the mouth or even in the side of their teeth. Just far enough. Don't put pressure on the end of this plunger. So I'm going to grab her scruff and pull her up gently and use the end of the pill popper to open up the side of her mouth all the way back, and I'm going to push the plunger Out we go. And you can even rub the bottom of their throats a bit, or even the tip of the nose to encourage licking. So I'm holding her up, just waiting for her to swallow. She wants to be sneaky and not swallow. There we go. So remember, when administering medication to a cat, the safety of the cat, and especially your safety, is the biggest concern. If you have any questions about administering medication to a cat, consult your veterinarian.